My name's Sarah Jones and I'm from the Australian Institute of Health and Welfare. My presentation is called 5 Key Lessons for a Cross-Jurisdictional Data Linkage Project Win-Win. A little bit about my project or study. It's called the Coordination of Healthcare Study and is essentially composed of 2 parts. The first is the 2016 Survey of Healthcare, which was developed to bridge a data gap on patient-reported experiences of continuity of care. The questions in the survey covered self-reported experiences of health service use, questions about self-reported health, long-term health conditions. The target group, the cohort for the study, were people aged 45 years and over who had had at least one GP visit in the year before sampling, according to the Medicare enrolment database. Out of a sampling frame of about 124,000, we had 35,495 responses. Data collected were weighted to population benchmarks before survey estimates were made. The second component of the study is linking those survey responses to administrative data sets, Medicare benefit schedule statistics, pharmaceutical benefits scheme claims, and hospital and emergency department data. And this occurred from the period before the survey to after the survey, so from 1st of January 2014 to the 30th of June 2018. The study participants were asked to consent to linking their data, and there were actually 2 separate consent forms, one for the MBS PBS component and one for the hospital and emergency department data. What this meant though is that some people consented to all of it. Some people only filled in the consent form for one, and some people filled in the consent form for the other. And so we do have these different numbers that we're working within in our analysis. This slide I've put up just to show the complexity, the governance and the committees that we are working with. So we had originally put through to the Department of Health Human Research Ethics Committee, which has actually been disbanded. And then for the hospital and emergency department data linkage component, we've had to put through to almost all of the states and territories. Some were willing to accept the AHW's ethics approval there. I think there's probably about 9 ethics applications in total. And then you've also got the state and territory data linkage units, you've got the data custodians, we've got our own internal advisory committees, and Department of Health Data Assessment Panel, which is DRAP. And dealing across federal agencies means that we've got different committees to deal with. So there's a lot of governance there, which ultimately leads to some problems and that we have to find solutions for. So my presentation around the 5 key lessons are lessons that I have learned from doing this study, and if you are considering a data linkage project, I think that these can help you along your way. So lesson 1, engage early and engage often. It's a really great idea if you can tap into some existing committees. If they have representation with state and territory level, then that would be ideal, and leverage these existing committees. It gives you 2 advantages. One, that you might be able to get some feedback and early input into your process, into your data linkage protocol and your technical specifications, so that it is correct, which should make for smoother sailing in the longer term. But it also creates an awareness of the project, so people know about it, and hopefully further down the track, when sign-off and approvals come their way, that they will be able to relate back and know what this is, or one of their colleagues will know what it is. Lesson 2, be specific. A clear technical specification leaves less rooms for misunderstanding or for errors. As a result of the committees, this was put to early on, there were some key principles for data linkage that were identified, which we incorporated into a data linkage protocol. And we also developed a step-by-step process to try and be very clear about how the data linkage was going to happen, which I won't go into because it's obviously quite technical. And the other part of confusion that we had to clarify and develop a resource for was the transfer of how the data is going to be transferred. So to make sure that all our stakeholders understood how that was going to happen, and we circulated a resource for that. Lesson 3, context matters. Each state does things a little bit differently from the other, as we do know. So take into account local context and legislation which might affect your processes. We certainly had a situation where one of the states, we needed to meet some requirements for their legislation, and what that meant, to deal with that, we pretty quickly had to get our privacy champion and organise a conference call with the right stakeholders in that state to get to the bottom of the issue and to understand and clarify and to make sure that we're meeting their legislation as well as the other requirements that we needed to meet. So the chances are that you might find out by chance, which is what happened to us. So it's really great to engage with your state representatives to understand context and resolve issues. Lesson 4, governance and ethics take time. Be patient. I think one of the key things that I'd recommend from my experience, and this is certainly something that we try to do and maintain, is to keep a master spreadsheet of all the contacts, all the executive officers, and when you get an approval through from an ethics committee, to make sure that you write in the due date for an annual report, and any requirements that you need to provide, because more often than not, these things can become quite confused, and there were quite a lot of times where what we had documented didn't match what was documented in the state and territory. Things, it tends to be that executive officers are overwhelmed, especially in ethics, because there's so much documentation that goes through. It's a really good idea to check, recheck, follow up, ask if you need to complete any mandatory training, particularly for all your researchers. Maintain a list of key researchers as well, and have their CVs or a short CV on hand, because you'll be asked to provide that, and make sure that you have the correct name for the person who chairs the ethics committee if you're writing a letter to them. Lesson 5 is to liaise broadly across and between organisations. Some parts of the process you need to engage with members from your organisation, and some parts of the process you'll need to engage with, obviously, people from outside of the organisation, and some of the people outside of the organisation need to liaise with people from a different organisation. So you might have a data linkage unit that's not part of a state health department, and they need to liaise obviously with the data custodians. It's quite hard to manage that. However, you sort of, as a project manager, need to be able to join the pieces of the puzzle together and communicate and liaise broadly and make sure that you've got all the right people and ask questions. It's a really good idea if you can find a kind of a key champion person that you can use in each state who understands what you're doing and can facilitate the process. I certainly found that made things a lot easier. And you only come across that when you build a relationship and are in contact often. So that's my recommendation. So for more information on this project or anything that I've said today, you can email the Coordination of Healthcare Study at ahw.gov.au. We have also produced some reports on the study, which are available on the AHW website. There's reports around information sharing between providers, experiences of barriers to accessing healthcare, use of hospital and EDs in Australia, which uses the linked data, and we're also working on another linked data project for the hospital and emergency department, looking at lower urgency care and our survey population. Thank you.